My parents are both doctors and they are from India. They worked at a mission hospital whose mission was to serve the poor in the community. And so I was exposed from basically as early as I could think. I was exposed to this need for care for the least served populations. So it made sense to work in global health. There are a lot of global health opportunities for residents at IU. It's one of the reasons why I'm here and many others are here. I've been working in Kenya since 1996 and in Uganda since 2001. My studies in Kenya are on how malaria transmission affects immunity, and we've been working in highland areas where there are epidemics, and recently the incidence of malaria has gone way down due to a number of different interventions. So our work now there is to get the incidence from low to zero. The focus of the work in Uganda is we're looking at why kids get severe malaria and why children get infections in sickle cell disease. And so I partnered with Bob Apoka, my main Ugandan collaborator, and Russell Ware, who's an expert pediatric hematology researcher at Cincinnati Children's, and we conducted a study on using hydroxyurea in children with sickle cell disease in Africa. This drug has been used for a couple decades in kids in the US, and it's been shown to be very effective at reducing pain crises. There's a lot of promise that it reduces end organ damage. We found that it worked great. There was really no substantial harm. Adverse events were far less in the hydroxyurea arm than the placebo arm. And so within the space of a year and a half, the Minister of Health in Uganda officially approved hydroxyurea for treatment of kids and adults with sickle cell, and said that she was working in partnership with a pharmaceutical company to make it lower cost so that it could join the essential drugs list for Uganda. And so to see a clinical trial and the results of that clinical trial informing public health policy in that country was just extraordinary. And it's example to me of what you can do when you do a partnership. We couldn't have done this without Russell. We couldn't have done this without Bob. We couldn't have done this without our amazing no harm team. So it's just a very fulfilling thing all around. I think the most important thing in global health research anyway is to understand how much we learn from our colleagues in our partner countries, and to be respectful and humble about that, because you couldn't do any of this work without your partners. They're teaching you stuff and that you need to respect and learn from what they're teaching you, and it's teaching in many different areas. So I think that consistent respect for your partners is critical. The goal across IU, I think, really is all of the programs here, the very clear guidance and intention and goal is that these are partnerships, and that all of our work is designed to help foster greater capacity. So there are many places in which residents who want to do research or clinical work or education, really any of the three, can find a niche within the programs we have here.